So what we're going to be doing here is phlebotomy. So the point of the tourniquet is to, number one, make the veins bulge. And so this is going to be easier to get a stick, and it's going to make it harder for the veins to collapse when you go to stick them. So easier to identify, easier to stick. And so we got blood flowing into the arm and blood flowing out of the arm. And so what we're trying to do here is we're stopping the blood from leaving, right? We're not stopping the blood from coming in, we're stopping the blood from going out. And so that's going to make the veins bulge. And so first time, we're using this to help identify. We're going to create a slip knot right here. So it's going to be easy to take that knot down whenever we need it. Alright, and so we're examining the arm, we're looking for the vein, and so it's going to bulge, it's going to be a little bit of a bounce right there, and so we've marked kind of the orientation of that vein. And so nice, easy, we know where that vein is at. So once you've identified your vein, you're going to let your tourniquet down. The reason being is the second you put that tourniquet on, your blood values start changing. Now, we really don't care until it's been on for about a minute, because the amount of change becomes clinically significant. It becomes big enough of a difference that it actually changes what you're going to do. And so one of the big things is we're interested in what's going on with the heart, brain, kidneys, lungs, internal organs. So if we wanted a really good answer, we could do an IV and do a blood draw directly from the heart. The problem with that is there's a lot of risk involved. And so we say, you know what, we're going to use the arm, that's good enough. And for most of the time, that is good enough. But there are some situations, aka you leave the tourniquet on too long or you pump your fist, where it doesn't become good enough. And so it's very, very important to not pump your fist and not leave the tourniquet on for more than a minute, because now it's no longer a good picture of what's going on with your internal organs. Okay, so the next thing we're going to do is we're going to clean this arm, and we're going to make sure it's really, really clean. Why? The number one cause of a false positive on blood cultures is you didn't clean the skin good enough. So I actually like to use a couple of alcohol swabs. I'd much rather clean the skin too much than not clean the skin good enough. These alcohol swabs are very, very cheap. It's a lot cheaper than having to do the same blood draw twice. Why? You're paying for all sorts of lab equipment, you're paying for blood cultures, you're paying for time, then of course the patient's not going to be very happy. So while you're allowing the alcohol to dry, you're opening up your phlebotomy supplies. So it can be a little bit of a challenge to do with your gloves, but you want to wait to later to do this, because once again, we don't want bacteria landing on things. So you notice I'm going to put my test tube in my tube holder over here, right? And the reason being is if I push all the way through, what's going to happen is it's going to suck air out from the atmosphere, right? The stuff that we're breathing. And so now it's not going to be able to suck blood from that person's arm. So you place it in here, but you don't push it through. All right. Now take the cover off the needle. And so you look right there. This is the slant of the needle. It's called the bevel. And you want that facing up, not facing down when you stick your patient. Now I'm going to put the tourniquet back on the patient's arm. Once again, I want those veins to bulge to fill it with blood and make it easier for them to be stuck. So relocating the vein. Alright, there it is. Now, one of the things you need to pay attention to prior to any sort of stick is make sure that all your equipment is ready to go. You see how I've anchored the vein. This stops the vein from rolling to the left or the right when you go to stick them. The other thing is you're checking your surroundings. Notice the tube has fallen out of the tube holder. Those things happen, right? Now, the last thing you want to do is, in the midst of trying to draw the blood, it's having to scramble and redo everything. So always recheck your surroundings before you actually punch the needle through their skin. And yep, there it is. I caught it. So I put the tube back in the tube holder, place that a little bit closer. And so now, one of the things I like to do is I rest my hand on the patient, right? And the reason being is that the patient moves back, forth, up, down, I'm moving with them. I've locked out the elbow, and as soon as the tip of the needle punches a hole through the skin, I'm going to push this tube through that tube holder. One of the big things that's really important is never let go of the needle. You let go of that needle, you're going to lose this orientation, right? You want about 20, 30 degree angle with respect to the arm. You lose that, you lose. So don't let go of this needle. And so once my slant of the needle has punched through the skin, I'm going to push my tube into that tube holder, and that's going to activate the vacuum, and it's going to draw any sort of blood. The other thing I like is you see the way I hold this needle. You can actually see that window right there, and it's going to make it very easy that you're in the right place. And so you'll actually see the red blood move up and through this. Unfortunately, this was a hard stick for whatever reason, and I didn't see the blood, so I was unfortunately unsuccessful here. And so just because you weren't successful doesn't mean you did a bad job. Sometimes you have a harder patient. And so you have 2 tries. If you're unsuccessful on the second try, you're going to have somebody else do it. And so right here, I'm going in deeper, deeper, deeper. Okay, I don't see any blood. So now I'm going to come back slowly, right? So sometimes for whatever reason, you overshot the vein, so you actually went all the way through the vein, but didn't see any blood in your thing. And so as you go back slowly, you might see the flash of blood. So if you are unsuccessful, you're going to let that tourniquet down. And now what you're going to do is you're going to do your post-venipuncture care. You're going to put the gauze on there with the Band-Aid. And so that is how you do a venipuncture. Oh, one thing is this is the most dangerous part of your job now. That needle potentially has Hep B, Hep C, HIV in it. And so you're going to act like it does. Why? I'd much rather treat blood that doesn't have an infection as though it does. And that way, if I do, I don't get stuck. Or if I do get stuck, I get evaluated, treated right away, and I don't have a problem. Versus the other, hey, look, they're fine, I don't have to worry about it. Now I get exposed to blood that does have Hep B, Hep C, HIV, and now I have a lifelong problem. So, always you want the sharp box right by you. The second you're done, you're going to put that needle into the sharps container. All right, how much blood do we draw? Let's say I'm doing a test that involves a red top tube. I need 2 tubes. Why? The first tube is going to suck air out of this line and get the blood flowing. The second tube is the tube that we actually send off to the lab, right? So very important, make sure you always have at least 1 more tube than the number of tubes that you need to collect. The other thing you need to be aware of is the order of draw, right? You just don't randomly collect blood. You have to collect it in a specific order. If you don't, what's going to happen is this tube is going to actually have some of its chemicals in the next tube. And that will change how my blood behaves. And so I can actually get an inaccurate lab result. All right, that concludes today's episode. If you liked what you heard, be sure to click the subscribe and like button down below. And as always, if you have any questions, comments, concerns, or if there's any particular topic you'd like me to create a video on, let me know in the comments down below. All right, well, I look forward to seeing you on my next podcast.